Hello guys, how is everyone doing? I have read plenty of requests about people asking me about being very anxious and scared and having to start their Nclex review because it seems that there's just too many things to retain and remember, so many normal and abnormal values and measurements to remember. And so many of you guys start to have what we call analysis paralysis, right? Which is basically just anxiety of having to start, don't know where to start. Well, it is a fact that you do have to know all these things, right? Just like a licensed CPA or a lawyer or even a doctor. Not to say that these jobs are all equal in their level of difficulties, but each one, as a licensed professional, do need to show a level of knowledge, right, in order to show competency. And also understand that as a nurse, you do have to you have the patient's lives in your hands, right? So with that in mind, I think first need to be confident and know that hundreds or and thousands or even millions of people have taken this NCLEX exam in the past and have passed it, right? So therefore it's possible. Also, second, anxiety has a negative effect in your ability to be in a flow state, right? And have your ability to retain information. So get rid of anxiety and just you gotta trust the process and just do the work, okay? On that note, let's begin this review. Now, for today's review, we will be looking at an NCLEX cardiovascular related review question which looks at the basic assessment of a patient with PVC, okay? So, the question is, we are having a client who is having a frequent premature ventricular contractions. You as a nurse should place priority on assessment of which item? 1. Sensation of palpitations. Number 2. Causative factors such as caffeine. 3. Precipitating factors such as an infection. Or 4. Blood pressure and oxygen saturation. Okay guys, so we have a patient who is having premature ventricular contractions, right? PVC, which is basically an extra abnormal heartbeat that begin in one of your heart's two lower chambers or ventricles, okay? Now these extra beats disrupt your regular heart rhythm, which causes what we call a skipped heartbeat, right, in your chest. Now, understand that premature ventricular contractions are very common and they can actually occur in most people. So basically, if you do have an occasional premature ventricular contraction, but you're a healthy person, there's generally no reason for concern and no treatment is needed. But if you do have frequent premature ventricular contractions and you do have an underlying heart disease or a diagnosis, right, you may need treatment, okay? So premature ventricular contractions, it causes what we call hemodynamic compromise, which basically your hemodynamic or blood movement is compromised. Therefore, the priority is to monitor the blood pressure and oxygen saturation. So the answer here would be number 4, which is blood pressure and oxygen saturation, because since if we look at our ABCs, right, our airway, breathing and circulation, our breathing and oxygenation is the number 1 priority, right? So also understand that the shortened ventricular filling time in a patient with PVC can also lead to a decrease in cardiac output. So we do have to be aware of that. Now the other answers are number 1, 2, and 3 are actually a causation or a causative, what we call physiological stressors, right? It's actually physiological stressors that can cause a premature ventricular contraction, such as a patient having an infection or an illness or a surgery or even an intake of caffeine or alcohol, okay? So guys, I'm just going to keep this short and sweet. I know you guys are busy. Again, thank you. Thank you for visiting. I wish you guys a blessed and a wonderful day. Study hard. And don't forget to visit my website at www.allnursingnotes.com. Again, I wish you guys the best. Thank you so much. Again, thank you so much and God bless. Have a great day.